Hi, good morning, everyone. I'm Dhilip Mohanan, speech language pathologist of Neurogen Center. So, I have vast experience in treating autism childs and cerebral palsy children. So, nearly 7 years I've been involved in treating children with autism, and I have an experience in working in Bangalore too and different parts of India. So today, let's talk about speech and language approaches for children with autism and cerebral palsy. Yeah. First, moving on, we'll start with autism. Because what is autism? Autism is a pervasive developmental disorder that varies on a spectrum from mild, it varies from mild range to profound range. So, what and all type of problems the child can face is the child can face a problem in social interaction, and the child can face a problem in impaired communication skills, and the child has a problem of repetition, which you can say as echolalia. Most of the parents tell that whenever I tell something to my child, the child is repeating back the same thing. That is known as echolalia. And next is the stereotypic movement. So children often do that fidgeting and hand flapping when they're excited, or biting. So a lot of stereotypical movements too, and which are all combined with narrowly circumcised and obsessive interest. So it happens when they are mostly excited, or when they're when they want to show their emotions. Moving on to the prelinguistic skills, what is meant by prelinguistic skills? Before any language develops, these are the precursors of a language development. So these are eye contact, eye-hand coordination, and attention and sitting behavior, which are four main aspects the child lacks in. First, I'll talk about the eye contact. How will be a child with autism has an eye contact? You would have noticed. And the child with autism will have maybe a good eye contact with parents, but the child will obviously have a poor eye contact or fair eye contact with strangers or new people. When new people visits your home, the child can't able to face them. The child is not giving an eye contact to the people. And next thing is like eye-hand coordination. What is mean by eye-hand coordination is, for example, the child is doing some thing with the Legos or blocks. The child is not seeing and doing it. The child looks somewhere else and then the child does it. So this is known as eye-hand coordination, where it involves. So good eye-hand coordination should be present whenever the child is doing some activities. And next is the attention. Most of the child lacks in attention for any activities. For example, if you make the child sit and do some activity involving building blocks or involving a fishing game or any games, the child cannot sit for many times. The child has a poor attention, the child wants to shift back, or the child will suddenly have an interest to some other things. So the attention is some aspect with which the autistic children will face a problem with. And next is the sitting behavior. You would have seen the child will have sometimes you can see the child cannot sit in the same place for a long time. If you want, for example, you're giving a activity on building blocks, the child sits with you and plays with that for just some time. And suddenly the child shifts back and go and play with some other activity and runs away from the seat. So sitting behavior is something which is directly involved in attention and which has a direct impact on therapy. So these four aspects the child with autism lacks. Next is, what is the problems the children with autism faced in social communication? They will have, obviously, there will be lack of eye contact, and there will be joint attention will be impaired. What is mean by joint attention? For example, you are doing some activity. So in that case, if you focus on doing that activity, you're doing it. So if some other people, for example, a mom or dad wants to play with the child cannot able to join them in the play behavior or play skills. So the child wants some separate time, and the child doesn't have an interest playing with other people. The child wants to play only with him or her. So that impairment can be faced in social communication. And next is the child will have emotional, the child cannot understand the emotional engagement. That is, sometimes if mom acts like I'm crying, mama is crying, but the child cannot comprehend that. The child cannot comprehend the mom is crying, or suddenly whenever the mom is getting angry, then the child can understand. Sometimes the child understand the angry emotions. The angry emotion is the basic emotion which the child understands first, and that's angry the child can able to understand. But if crying, sometimes the child cannot understand, and you could see your child with autism will have an emotional deficit. And next is the child cannot able to point to an item. There are many things the child, I mean the people confuses what is mean by pointing. Some people tell that my child picks my hands and take to the desired object, and they say that this is known as pointing, and my child is pointing, but actually that is not pointing. Pointing means the child takes the index finger and directly points at the desired object. That is exactly known as pointing. Pointing is not the one which the child holds the parent's hands and takes to the desired object. That is not pointing. Yeah. And next is the problem in what type of problems can the child face in communication. And the communication, obviously, there'll be delay in speech and language development. For example, there is some age known as chronological age and something that is known as language age. Chronological age is the actual age of the child. And language age is something the child which should have, I mean, at that particular age, the child should have attained that particular necessary items. For example, a child by the end of 1 year should have attained at least 3 to 4 words. But if the child is not attained 3 to 4 words, then the child belongs to the category receptive expressive language disorder. And next is age appropriate speech and language development, but aberrant patterns may be noticed. Maybe you would have seen your child speaks well, understands well, and you feel that there is age adequate language development. But you could see sometimes stereotypic behaviors, head nodding, head shaking. Suddenly the child gets up and starts making some different sounds. So these are the things mainly parents complain. My child is normal completely. My child can speak everything, my child can understand everything, he can follow commands, but he does sometimes do some behaviors which we couldn't understand or control. So those are being noticed. And next is regression in speech and language skills. So some parents would have told, like, my children had a normal language development pattern. That is, at 1 year, my child spoke mama, papa, many words. But suddenly after 1.5 years or 6 years, 1.5 years or 1.8 years or 2 years, after that, my child stopped speaking or he's not uttering a word. So that is known as regression stage in speech and language. And what are the other features the child with autism can face? That is physical affection and separate. Sometimes anxiety can be faced by these children's fear. Mostly the anxiety, maybe it is common in most of the autistic children. And wandering, they wants to wander around in the room. They doesn't want to sit in one place. Once again, it comes to the sitting behavior of the child. And next is lack of fear and danger concept. The children with autism, they doesn't understand the danger concept. They jump, they wants to go hang and jump around from anywhere, any height. They're not afraid of that thing. And next is picky eating. Most of the children with autism, you would have seen, they doesn't like fruits, they doesn't like foods which are munchy type. They like most of the crunchy foods. So these are known as picky eating, which is more common in children with autism. And what are the other things which can co-occur with autism? These are the other things, that is ID, that is intellectual disability, and epilepsy, epileptic attack, we say. And next is anxiety disorders, fear disorders, and attention deficit hyperactivity disorder, the hyperactiveness. The child doesn't like to stay on particular activity or particular interest. The child keep on shifting his or her interest. And next is sleep disorders. The child will have an improper sleep patterns. Maybe the child will like to sleep in the morning and suddenly the child wants to sleep, be awake at the night, or suddenly next day the child wants to sleep at the night and be awake in the morning. So the sleep patterns may be improper. Okay, Now we move on to the main topic, that is echolalia. Why one thing which the child repeats back whatever you tell to her or him. So, for example, give me the chocolate. So he will also tell you like, give me the chocolate without understanding the context. So why echolalia arises? Whenever the child doesn't understand the context, contextual communication, echolalia can occur. So, for example, you keep on forcing your child, say chocolate, say chocolate, say chocolate. Obviously, the child will say chocolate, but the child does not understand what is mean by chocolate. Say papa. That's the main thing. Many parents complain that my child speaks mama, papa, but he doesn't know who is mama, who is papa. So that is the main complaint. So that's because the child doesn't understand the contextual communication. So whenever we do a speech therapy, we should make the child understand what is mean by contextual communication. Who is mama, who is papa? So we should facilitate the therapy in such a way that the contextual communication arises. Next is most of the parents ask me how to stop the echolalia. So whatever the child speaks, whatever the parents speak, the child repeats back. So how to stop it? So this arises because the child is not understanding the contextual communication. So in order to facilitate that, you need to make the child understand the context. For example, for this particular question, this particular answer arises. Maybe I would like to tell you about for example, I would like to give an example. So you're taking a child for a park in a car. So you're having a conversation with your child, tell her that, oh, we are going to a park. At the same time, suddenly ask the question, where are we going? The child will repeat park. Oh, okay, yeah. So the child understands this for this particular question, this particular answer is the correct. So encourage the correct answers. Right? So this technique is known as volume prompting, which is being used mostly for reducing the echolalia. So what is meant by that is, so give the answer and ask the question immediately. That is, we are going to the park. Where are we going? That's it. The child repeats back park. So the child understands for this particular question, this is the answer. So do this for every other communication also. For example, anything. Oh, where are we going? Are you going to play? Where are you going? Ask immediately the question. The answer should be first, immediately followed by the question. Okay. Usually there are three types of echolalia. So one is immediate echolalia. Immediate echolalia means, for example, if you tell chocolate, the child repeats back chocolate. There is second one, which is delayed echolalia. Delayed echolalia means when you tell chocolate, the child doesn't tell chocolate at that time, but later on, after 5 minutes or after 6 minutes, the child keep on repeating chocolate, chocolate, chocolate. It won't be sudden, it will be delayed. As the name only says, that's why it's delayed echolalia. And next is the mitigated echolalia. Mitigated echolalia means the child mixes up some other verbs or some other words and then produce the particular word. For example, if you tell chocolate, the child produces choco egg. So the child omits some other part of the word and puts some other word which he or she knows. So that is known as mitigated echolalia. It won't be actual form of the word. It will be a little bit replaced. Next is moving on to the behavioral aspects. Apparently inflexible adherence to specific non-functional routines or rituals, stereotypical and repetitive motor mannerism. Okay, what are the main repetitive behavior or stereotypic behavior being seen in the children? So these are some of the stereotypic behaviors, that is hand flapping. You would have seen most of the children when they're excited, they do the hand flapping, and they would like to stare at the lights. They like repetitive blinking and moving fingers in front of the eyes. They like that, and auditory tapping ears, snapping fingers. There are many things, fidgeting, smelling objects. Why is smelling objects or tasting objects the child likes the most than seeing an object? because the children with autism likes to feel the particular object than seeing it. More they like the sensory, that is tactile aspects, than see visual aspect. So that's why whenever you give some toy to a child, they likes to put it in the mouth and feel that. So that sensory aspects will be present in autistic children. And next is tactile rubbing the skin and vestibular rocking from front to back. They likes to put their heads front and back or right to left, and smelling objects. This will be common in children with autism. Okay. Next, moving on to the play in children with autism. So there are different types of plays being seen in normal children's. So whether these play behaviors are being seen in autistic children's, my answer is no. So as a children, we will start, for example, we would start a self-play. So as a child, like 10 months or 1 year, we would start playing with some toys, or we'll just like to explore. So that is known as self-play. Self-play means as 1 year or 1.5 years children, he sits and tries to explore the toy. That is self-play. And next stage comes the parallel play. The child likes to play with some partner, either a mom or dad. That is parallel play. Next comes the pretend play. The pretend play is something which is the child thinks this particular object is real and trying to do. So that particular pretend play will be absent in autistic children. And even sometimes parallel play is also absent in autistic children. The only play being present is the self plays most of the time. So why play behavior is very important for language development? Because we learn a lot of rules of the game. We learn a lot of important language aspects from the play behaviors. I would say the precursor of language development is the play behavior. It's very for a child to learn the play behavior, because the child can able to have the social aspects learned from this play behavior as well. But unfortunately, this pretend play or the parallel play are not being focused much usually. But we need to facilitate the pretend play to the children. For example, and we are taking the injured animals to the hospital in a van, and then getting them treated with bandages. Maybe you can take a sellotape and understand these concepts once they are getting exposed more and more. And sometimes you can have a play behavior like you can take a vessel and fill up with the water, and suddenly you tell that, okay, the animals are going to take bath inside let's make the animals take bath. Okay, first goes the zebra, next goes the tiger. So the child gets interest. Usually autistic children loves water. It's kind of an activity with a lake, and they love it. So that's why the pretend play is very important for the language development. We need to focus on the pretend play. And moving on to the intervention for autism. Okay. The autistic intervention process, we should not get delayed. Maybe some parents think that, okay, my children will wait for 1 more year, my children will start speaking. But actually you are making a wrong thing. You should not get delayed. You should act abruptly. You should do it at the right time. Sorry, yeah. Several approaches have been proposed. So first one is for speech and language intervention. So in speech and language, we mainly focus on the prelinguistic skills. As I told at the starting of the webinar, that is in prelinguistic skills, we focus on eye contact, sitting behavior, attention, and eye-hand coordination. All these 4 aspects, we give a lot of activities to be done. For example, maybe building blocks, a fishing game, as I told earlier, and you can focus on a puppets game, and you can focus on, first you have to identify the liking of the child. You can't force a child with every other activity you get in the hand. First, you need to, not all the children are same, because that's why I'm telling you, not all the children are same. First, we need to identify the likings of the children, then we need to focus accordingly. For example, some children will like water games, so we need to expose a lot of water games for the children. And some children will like to play, like they doesn't want to sit in the chair, they just want to run away and they want to play with just running around. So for them, you can have a good activity like maybe you can take something like fruits pictures and then put it in the floor. So, and take him, okay, can you step on the apple? Okay, now he has to step. And initially, you need to give a lot of physical prompts. Physical prompts means you have to hold his shoulder, or you can hold his hand, or and then facilitate him in moving towards the object. And he has to step on the apple. Then mommy says, grapes, come on, let's go move towards the grapes. So he has to go to the grapes. So this type of activities increases the child, and the child likes it than doing it on the tabletop. And next is focusing on the comprehension skills. Why comprehension is important? What is meant by comprehension? The understanding. First, the understanding should develop. That's how the child starts speaking more. So that's why I'm focusing more on the comprehension. Mainly comprehension is following commands. Most of the child, you could see the child won't focus two-stage commands. There are different commands. For example, single-stage commands, two-stage commands, three-stage commands, and complex commands. So if you see, most of the children follow simple commands, that is our one-stage commands. That is give me, go there, sit down. All these are simple commands the child can follow. But next is the two-stage commands. That is go to the kitchen, bring me the onion. That is two-stage commands. Next is the three-stage commands. That is go to the kitchen, take the onion and bring it here and chop it. So you're giving three instructions in the same sentence. That is three-stage commands. And next is the complex commands. Complex commands means you're involving prepositions, adjectives in the same thing. I mean, in the same activity. So that is, okay, go to the bedroom and bring me a blue color t-shirt. So you're involving a color concept there. So these are known as complex commands. So these commands, we need to be facilitated to the children. For that, we need to make them understand the prepositions, what is meant by adjectives. We need to introduce all these concepts as well. Most of the children, they think that, most of the parents, they think that my children doesn't understand all these. It's okay, he doesn't even can't follow the simple commands. Why is going to follow the prepositions? No, we are wrong. See, if he's not able to speak anything, it doesn't mean that he doesn't understand anything. The comprehension, that is the understanding age and the expression age, can be different. Okay, maybe he cannot able to say a single word, but he can understand better. Never restrict your children's vocabulary. Never restrict. And that's why we focus on introducing prepositions, adjectives, and adverbs too. For example, you can have a good activity at home. For example, you can take a fruits, real fruits, or a fruits model, or a toy of which he likes. You take on 5 toys or 4 toys and start hiding it on the different areas. But hiding in a sense, you have to tell him where you're hiding it. For example, okay, daddy is going to hide orange on the fridge and the apple under the table and potato behind the TV. So after hiding it, then now you have to give instructions one by one. Okay, now go get the apple behind the TV. So he has to go get the apple behind the TV. So first, at starting, you need to give a lot of physical prompts, that is holding his hand and taking it to the object and taking it. So he needs a lot of physical prompts at first. And next is the directional aspect, following the directions. You need to show him the directions. Okay, it's behind the TV, it is under the table, and it's on top of the roof. So it's like you need to first focus on above, below, and behind. All these 3 aspects mainly, than focusing on other preposition aspects. Only these, first focus on these 3 primary aspects: above, below, and behind. Yeah. And next is, let's move on to the expression skills. The main important thing in expression is pointing and gestural communication. As I told before, the many children with autism cannot able to point to the desired object. It doesn't point correctly to the desired object. Instead, they take the parents' hands and take to the desired object. So that is not pointing. First, whatever the child needs, for example, you're giving a chocolate or milk, so make the child to choose between the two. Maybe you make him to hold the fingers, all of the fingers except the index finger, and then make him to point to the desired item which he wants. Okay, you want chocolate or you want milk? Okay, you want milk. So the child, when sees the desired object, the child starts showing some interest. So, okay, you want the milk. Okay, here we go. Let's take the milk. So that's how he slow by slow understands. Okay, if I show like this, I get the desired item. And he starts pointing more. And next is the mean length of utterance, which is more important in comprehension. Mean length of utterance means like how many words or the child could able to speak in a short phrase or at the long sentence. It is known as mean length of utterance. We need to focus on the mean length of utterance, but the goal, we should design a short-term goal which is achievable. That, for example, if the child is speaking one word, we need to set a goal for like within 2 months, the child should speak 2-word level. That is, give me, go there. First, start with simple 2-word level and go with complex 2-word level. And next is, we are focusing on pragmatic skills. So what is mean by pragmatics? Pragmatics means, it is mean by the rules governing the language. That is how the language should be understood. That is, sometimes, mostly we should say the social aspects of the language. That is, the child cannot be having a proper eye contact. That is the main thing which is being noticed in the social aspects of communication. The child doesn't have a proper eye contact. So to facilitate proper eye contact, what can be done? You have to focus on activities which the child likes. Go with the child-directed approach than going with other, whatever you like, you want to impose on the child. Than that, we need to facilitate what the child likes. So choose activities which the child is interested in than other activities. And in social aspects, there are also following requesting. Mostly, if you see the children with autism, they like to grab things away. They doesn't like to request for any items. So this requesting has to be taught with a lot of physical prompts. Physical prompts is you have to hold his hand from down and then you have to make him to request. Okay, you want give me. Maybe if the child's at the starting, he's not doing any verbalization, but at least try non-verbally. Yeah, give me. So this has to be taught, because once the autistic children goes to school, maybe inclusive school or normal school, the child starts grabbing things. So that thing has to be avoided. For that, requesting is a major thing which has to be taught at the right time. And one more thing is the greeting skills. That is bye-bye, waving bye-bye, hi. So these things also we should give a lot of physical prompts and make him or her to do it. So that has to be taken care of. And next is turn taking. What is mean by turn taking? Turn taking means, for example, the child and mom are playing, child, mom and sister are playing, but the child doesn't like to wait for her turn. The child wants to play the game, continue the game. The child is not ready to wait for mama's turn or sister's turn. But this, whatever the activity you do an activity with turn taking. That is, involve other people, plus have him or her take turns. For example, now is your turn, you do it. And now it's mama's turn, mama will do it, you have to wait. And then now it's sister's turn, you have to wait. So doing this turn taking, which can build children's attention and sitting behavior too. And next is, we'll focus on topic initiation and topic maintenance. Topic initiation comes in the later part, because topic maintenance is the difficult part at first. If you take any topic, the child doesn't like to stay on that particular topic. The child wants to just finish it off and rush away. So this thing you might have noticed in children with autism, they doesn't like to wait. They just want to rush away. They doesn't want to stay in the topic. So for that, you should start with you should not make the child sit. You should not force the child to sit for an hour and make him or her to do it. That is a wrong way. First, make the child sit. First, you should have a target. For first week, the child has to sit at least for the 5 minutes. The child has to maintain a topic for 5 minutes, depending on the child's age. If it is younger, maybe you can set up to 3, the age of 3. For example, 3 minutes. Sorry, you can set up to 3 minutes. So if you have activity at least for 3 minutes, and then increase it day by day, because we can't force the child. Come on, you have to do it. You have to do it. That's a wrong way of doing it, which can increase her stereotypic behaviors too. Means she can become little bit of. She might start biting. She might start doing all kind of expressions to show you that she doesn't like the activity. So just wait. We'll do it slow. And next is, these are the other approaches being followed for children with autism. So in behavioral approaches, they focus more on ABC, that is antecedents, behavior, and consequences. That is to reduce the children's behavioral issues. So the psychologists focus on the behavioral issue approaches. And next is sensory integration therapy. Mostly occupational therapists focus on sensory integration therapies. That is a lot of sensory issues the child might have. So most of the occupational therapist deals with all these sensory integration therapies. And music therapy is being done by music therapists who are being certified, but not only limited to a number of people are available for the music therapy. Because we know people with, the children with autism loves music. They likes to hear music. So, which you can also try is the music therapy, which is new aspect, and which is also interesting for the child. Next is dietary modifications, that is being done by the dietitian and to reduce the behavioral issues, and they also give diet-based modifications. Next, let's move on to the cerebral palsy. Okay, what is cerebral palsy? Cerebral palsy is a disorder of movement and posture due to a defect or lesion of the immature brain. There will be a posture or movement problem of the immature brain. So what are the speech and language problems in a children with cerebral palsy? First, the children might have a problem with respiration. Maybe the children will have abnormal quiet and speech breathing. Sometimes the children will have a very quiet breathing, or sometimes children will have a speech breathing suddenly. And sometimes the child will have the breathing rates elevating and reducing. Sometimes there will be reduced respiratory reserve, and that is the children will go short of, cannot able properly. So you could see the struggle in the children's face, because there will be some respiratory problem with the children. That thing might be the laryngeal system. Laryngeal system, what things are being noticed is the children will have a different pitch. So what is the respiratory system? So if you could see some children, when you're feeding your children, mainly when while feeding the child, you can see the food materials coming out through the nose. So that we would call as nasal regurgitation. Feeding through the mouth and food coming out through the nose. So this happens when your children's respiratory system is weak. That is improper velopharyngeal closure. Velopharyngeal closure is something which is important for resonation. So that system has to close while speaking. So if that is not closing properly, then sometimes some sounds the child cannot able to produce properly. Plus, if that system is not closing properly, sometimes the food will enter and come through the nose. So that's how you see some nasal regurgitation, that is food coming out through the nose while feeding for the cerebral palsy children. And these are some other things which we have to as I told, that there will be problems in production of sounds. Sometimes non-nasal sounds, that is non-nasal consonants production, will also be affected. And next, let's move on to the articulator system. That is, if you see children with cerebral palsy, you could see there'll be 4 types of error you could see. That is mostly substitution, omission, distortion, and addition. So if you could see for example, a word like mama, the child could say mapa, mapa. So, or for a sound like teeth, the child could say teeth. So the child substitutes one sound for the other. So this thing happens when the children's articulated system has an issue. So that could be ruled out when uh, proper assessment is being carried out in particular speech therapy center. And next is language. How will be the language in children with cerebral palsy? If you observe language in cerebral palsy children, the language might be mostly delayed. That is, in case the child, by the end of 1 year, the child has to speak 3 to 4 words, but the child cannot utter 3 to 4 words. As in the same case like autism, there will be receptive and expressive. That is, understanding and expression will be affected in cerebral palsy children as well. And if you see difficulty interacting with parents and caregivers for their functional needs, for example, the children wants to go for a washroom, or the children wants to drink water, and the children wants to eat food, or hungry, the children cannot able to express for their functional needs. And next is parent is not able to interrupt the child's signals. Yes, obviously the child cannot able to show a mode of communication that he's hungry or he wants to eat something or he wants to drink something. He cannot able to express properly to the parents. So that's why parents have some difficulty in understanding his or her signals. And next is reduced ability to imitate communication. Yeah, obviously imitation will be affected. Unlike autism, like that is autistic children can able to imitate properly. But in case of children with cerebral palsy, the imitation is not possible much. Next, lack of ability to explore and interact with the environment and objects. So there will be lack of ability will be there. So exploring and for example, a child cannot able to play with proper toys, and unlike other children, they cannot play with environmental toys or any stimulant. They cannot able to play with everything. That we cannot. Seek from the children with cerebral palsy. And children may experience restrictions in the environment because of transportation needs. So yes, the environmental, they cannot just go around and play in any garden or anything because they will be having an environmental restrictions. And obviously, because of these issues, there will be school attendance as well will be affected because they cannot be regular to schools. And what can be done for children with cerebral palsy? Mainly, if you see in cerebral palsy children, you could see many of the mothers tell that my children used to drool. There'll be saliva coming out through the mouth. Mostly, this could be seen in most of the quadriplegic CP. That is, both the hands and legs have been affected. And those children, for the lip, that is for the drooling, what can be done is we need to improve his lip strength. So improve his lip strength by giving proper massages and proper oromotor exercises. So oromotor exercise is very important to improve your children's oromotor coordination and sensation. So that's how your children could able to eat foods also. For example, if he could eat at least mashed foods, could start with, or at least he could start producing sounds only when there is proper sensation to that particular area of the oral cavity. So that is being focused during this oromotor exercises. So that's why most of the clinicians, when you see the oromotor exercises, we start with for cerebral palsy children. And next is, what is our goal of treatment for cerebral palsy children? So our main goal of our main long-term goal for children with cerebral palsy is we focus on some functional communication. The children has to, at least speak, or in that, if the children cannot able to speak, at least show some kind of a communication to express his functional needs. For example, if the child is little verbal, the child we expect more verbal communication from the children. But if the children is completely non-verbal in case of quadriplegic CP, that is both the hands and both the legs are affected, in that case, we expect the child to speak in such, to express the need in any AAC methods. That what is meant by AAC, if you ask me. AAC is alternative augmentative communication. Alternative and augmentative communication means using, there is two types. One is low-tech AAC, high-tech AAC. Low-tech AAC is like something without any iPad or something. They use some pictures to exchange for the communication. For example, the children wants to go for washroom, the children just picks up the washroom picture, and the children has to point to the washroom picture to indicate the children wants to go to the washroom. Or if the children can able to use iPads, or the children first could able to indicate via the high-tech AACs, that is usually iPads. What we use is many softwares have been developed for functional communication. So via apps, the children can able to communicate his needs. That is, there are many methods. One is by pointing, and another is by eye gaze. So for quadriplegic CP children, there is something known as eye gaze communication. It's like based on his eyeball movement, like for example towards the left or towards the right, they could able to judge the particular thing which he or she wants in that particular monitor, and that particular thing has to be treated out. For example, the children wants to go for the children is hungry, the children wants some feed, so he could use his eye gaze. So this side there will be food, this side there will be some other thing. So the children has to point towards the left to pick up particular food item to locate for the needs. So this could be achieved only with the proper training. You need a proper trained speech pathologist to facilitate this type of communication. And next is functional verbal communication should be independent or supported by some type of augmentation. Yeah, as I told, we need to give some high-tech or low-tech functional verbal communication. That is text to speech or picture to speech. So there is some iPad apps you would have seen. If the children picks up, touches Apple, the monitor produces the sound Apple. So these are high-tech cases which can be used for children with cerebral palsy. And next is speech and language interventions. What we are focusing on cerebral palsy children, we mainly focus on improving their respiratory, laryngeal, and velopharyngeal mechanism. That is by changing the position of the children. For example, we are feeding a children in this particular, usually in the supine position, that is a wrong position. Most of the children are being fed in the supine position. If you feed in that particular position, the children is at the high risk of aspiration. So in that case, you need to the right posture for giving, the feed is the children has to be posed upright position with the head just front. So this is the ideal position for feeding. And next is facilitation of more normal feeding pattern, that is upright with head in front, and facilitating development of cognitive linguistic abilities. Why cognitive linguistic abilities we need to focus on? So if we need to focus on cognitive linguistic abilities to make the children focus on the functional communication for his or her needs. For example, if the children has to eat something, or the children wants to go for washroom, the children first needs to understand what is this picture means. So to make the children understand that the picture is mean by washroom, the children has to be given proper cognitive linguistic exercises. So giving mostly like a picture verbal communication. So that could be facilitated for a child to understand what this particular picture means. So that the children could pick from a particular main picture, children could pick up some particular picture from that. And to modify environment so that the child is able to communicate and lead an independent life. What is meant by modifying the environment? So modifying the environment of the cerebral palsy children means you're changing the environment of the children. For example, if the children is lying down, the children is not comfortable there. So you have to make him or her facilitate sitting in a CP chair. So there is a cerebral palsy chair which is very good for the child. In that particular position, the child feels more comfortable even for feeding and even for producing sounds. So changing this is known as modifying the environment for making the child to facilitate with swallowing and for communication. And this is the end of my session. And you have any doubts to ask me? Is there any queries?
Uh, yeah, a question from Lunga, like, if you come to India, could you see me? Yes, obviously you can visit me. I'm the speech pathologist at the Neurogen Hospital. You can obviously come here and ask me any doubts if you have. It's the hospital is centered at the Navi Mumbai, that is, it comes from Mumbai, which is suburban Navi Mumbai, and in the area of Seawoods. Zenzo has asked when is speech therapy proposed to start in the children with CP. So the speech therapy should start from the initial stage as well. Maybe you can start as early as possible, because the drooling, sucking, chewing, and biting, these four aspects are the main vegetative skills we need to focus on children with cerebral palsy. So in that case, you need to intervene the children as soon as possible. So I would say as early as we start with speech therapy, the improvement will be better. Okay, a question from Olivia: at what age should we start therapies in children with autism? As the same thing, as I told in my presentation as well, as soon as we intervene the children with autism, the betterment it will be. For example, there is some stages of language development. First stage is cooing. Cooing means the children starts producing ah, oo, e, these type of sounds. Next stage is something known as babbling. So the children starts babbling syllables, ba ba, bi bi, boo boo. So these are like babbling sounds. So next stage is variegated babbling. Variegated babbling, you could notice when the child is hungry, the child starts producing the child combines different syllables and starts producing the particular variegated babbling. That is baba, yoi. So these type of sounds are known as variegated babbling, which the child produces. And next stage is known as the jargon stage. If you notice, the children may produce a word, but that word doesn't have a meaning. And next stage is the one word stage. The child will reach the one word stage after crossing all these stages. So as soon as you intervene with speech therapy, these stages can be attained in the fast rate than compared to. One question from Olivia: what diet modification do we need for children with what do we do for children with autism? Yeah, diet modifications are there, but I'm not the best person to comment on diet modification. The dietitian is the correct person to comment on the diet modifications. So maybe like you have to consult a dietitian for the proper diet modification. So a question from Hope: my son is 7 and autistic. He talks, recites cartoon clips well, but cannot communicate verbally, like calling mommy or saying I want this or that. So how do we help him cross that bridge? Okay. So Hope, it's as I tell that we need to start the language intervention in contextual communication. Mostly what we do is, for the children with autism, most of the parents do is say this, but the children says it, but the children doesn't understand at what context the child has to produce. So we need to facilitate that with the help of speech therapy. So for example, if the child wants to have I'd like to give an example for requesting. The child wants a glass of milk. So you need to model your children first. For example, if mom has to sit near him and mom has to first model, Baba, I mean, Daddy, can you give me milk? Give milk, please. So keep it at short at the starting, maybe 2 word level. Milk, please, and Daddy gives the milk. So this is known as modeling. So you're modeling for your child. Next, the child will cease, but I'm not telling the child will do immediately. So you need to facilitate that communication by holding your child's hands and start doing the physical prompts. Okay, you ask like this, you get the milk. Come on, let's ask. So like this, step by step, you need to teach him the communication in context. So thank you. Thanks a lot for your support.